Good morning, everybody. Welcome to the Retired Living Truth series. My name's Brett Junell, and I'm your host today, along with my beautiful wife and partner who just solved our sound problems, Annette Junell. Today's topic, the truth about COVID in Northern Nevada. And I just briefly mentioned about the fact that most of you know us as real estate agents and how home prices have gone up tremendously over the past 12 months. And in part that is due to the fact that we have more demand than we have supply. And that's because homeowners have been reluctant to have strangers come into their house, which is quite understandable. And today's topic is a little bit different to what we normally do, but we thought it was so important because there's so much misinformation out there and people have questions regarding COVID, whether it's the vaccinations or the need to wear masks and so forth. So I thought we'd bring in some experts today to try to help clarify some of that and provide us with some good information, not what we just read in the national news, but local. So these are local experts that are on the ground who are dealing with this day to day. And I'll introduce our panelists shortly. Can you just pop me over to the next slide, Alexa? Or maybe I can. I should hide this as well. Windows open, everybody, everywhere. So I just wanted to acknowledge our sponsors who make the Truth series possible. And in particular, I just wanted to thank two sponsors today. And they are Yvonne Beasley up at the University of Nevada, the Sanford Center for Aging. And thanks to Yvonne, she was responsible for one of our panelists, who I'll introduce in a moment, being here. And a special thank you to Amy Beck at Prominence Health Plan, who was responsible for allowing one of our other panelists to be here. Alexa's giving me a thumbs up at the back. So yeah, just some quick housekeeping. So technology. So we've already had some technology issues and we guessed we probably would. So hang in there if things drop out or I hit the wrong button and the video disappears, we'll fix it. So don't log off, just stay there. Alexa will communicate to you via chat and let you know what's going on as we're trying to rectify anything that goes wrong. This is really a grand experiment for us, being able to do it in the room as well as being able to have it happening over via Zoom to 100 and something people that had registered to do it this way with us. And I just wanted a special thanks to a gentleman named David Armstrong from Sound Planning. He was instrumental in helping me put together the technology in the room to be able to do this in both modes. So I'm really appreciative of all the time he gave. And also for our partners here at the Reno Sparks Association of Realtors, who had faith in us to go and invest a whole lot of money for cameras that are in the room that rotate and do all sorts of things and a whole control panel at the back to allow us to be able to do this for those who want to be in the room and for those who prefer to be via Zoom at the moment. So the format for today is I'm going to spend about 50 minutes, probably 48 now that we've lost some time, interviewing our panelists. And then at approximately 11 o'clock, we'll open it up to audience question and answers, both here in the room and for those who are on Zoom. And we'll talk again about how that's going to happen. Everybody should have a handout. In the room, obviously, we have handouts. The email that came from Zoom this morning, if you look closely, we added a link in there so you could download the handout. So the email that went out about an hour ago has a link with the handout that the people in person have. And if you didn't get that or you've already deleted it, we'll send out an email tomorrow. And the reason the handout is so important, it has a whole lot of great resources on there that we're going to talk about today with the panelists. Alexa, can you just put up the poll while my speakers, panelists, come up and join me? If Dr. Anderson and Jennifer, you could come up and join me up on stage and just turn on your microphones. We're really just curious to know where we're at as far as the vaccination process goes. So Alexa's just put a poll up for those people who are at home, and I'll ask the audience the same questions, only if you're willing to share. And this is anonymous too, by the way, so those who are at home, we don't see who's saying what answer. There's no way for us to look at that, and we don't need to. But I'm just curious for those who are here in the room, who's already had their first vaccination shot, if you're willing to share just by a show of hands. So 4 people, great. And then what about the second vaccination shot? Oh, we've got one who's already had their second, great. Anyone waitlisted for vaccination? As anyone maybe who doesn't qualify due to age or some other reason? So yeah, me too, not too young. That's a nice thing to say, I'm too young. And then not going to be vaccinated, and then other. So we'll just leave this up for a few minutes and let people have a chance to respond. And while doing that, I'd just like to introduce our panelists. If I could start with you, Dr. Anderson, could you just tell us who you are, what you do, and why you might be here today?
Yeah, good morning. Travis Anderson. I'm the Chair of Emergency Medicine for Northern Nevada Medical Center, and I help run our emergency department there in Sparks and also our new emergency department on Mayan and McCarran. You can't hear me?
Speak up a little louder.
Okay. Can we hear in the audience on the technological side on Zoom? Okay, I can speak louder in the room. Sorry about that. I'm Travis Anderson, Chairman of Emergency Medicine at Northern Nevada Medical Center, and I help run both our emergency departments in Sparks and our new one on McCarran and Mayan. I've been very involved with our COVID planning from the beginning at our medical center and with the local and community partners and all the other hospitals in town. And I've been involved with our vaccine rollout at Northern for our staff, and I've been involved in the community with getting out the word about the vaccine and treatments and kind of what our status is with COVID-19.
So thank you. It sounds like you know a little bit about this.
A tiny bit, yeah.
And can we just do a check from home if people could put up their hands if they can hear Dr. Anderson okay? In fact, maybe I can just bring up Audrey and just check before we go too far. Say that again, Alexa. Okay, I'm going to use Audrey as my test person again.
Yes, we can hear fine.
That's fine, Audrey. Thank you so much. I really appreciate it. Awesome. If you could just unmute yourself, Audrey.
Oh, there you are.
So yeah, we're dealing with the challenges here of how to do it live and as well as what you see at home. So now I think we just changed it so one of the cameras is pointing to our panelists and you can see how handsome and beautiful they both are. And I'm not too bad myself. So if we could jump over to you, Jennifer, could you introduce who you are, why you're here today, and a little bit about what you do?
Yes, my name is Jennifer Wheeler. I am the Chief Pharmacy Officer at Community Health Alliance, and I am also oversee all of our COVID-19 vaccine rollout for the community.
So you also know a little bit about this topic?
A little bit.
Yeah, wonderful. So let's just have a look at our survey results. What do we have? We have 40% of people have already had, who are on the call today, have already received their first vaccination shot. 29% of people have received their second. We have 7% waitlisted, a few people that don't qualify, a few who at the moment don't wish to be vaccinated, and then a category of others. So kind of interesting. Is that what you guys would kind of expect in terms of, population in general?
Agree,
Yeah. For the senior population? Fantastic. So Jen, my first question I have to you is just tell us a little bit about where we are in the vaccination rollout here in Northern Nevada.
All right. So actually, as most of you may have seen, the Governor Sisolak did change the regulations that are going to be starting next week. And I think we have a slide that goes over the prioritization lanes. So there's what we call a left lane and a right lane. The right lane is the general population, and the left lane is the frontline and essential healthcare workers. The lane on the left is primarily focused on by Washoe County Health Department. They target employers who then contact their employees once they become eligible. That lane is very tricky and it's very hard to understand. And a lot of people feel like because they were an essential worker throughout the COVID-19 pandemic, they feel like they're eligible. And so that's where we're running into a lot of, I believe I'm eligible, you're not eligible. So Washoe County Health Department is primarily focusing on that. And then they do the employment verification piece as well as pay stub piece. The rest of the pharmacies locally are focusing on the general population. So up until this Sunday, it was Nevada 70 years and older. And now certain pharmacies, as long as they're getting federal allocation, and that's the key component of what Governor Sisolak said yesterday, will go down to 65 and older. The federal allocation piece is where the federal government is directly shipping vaccine to certain pharmacies. I believe in Northern Nevada, that is going to be, oh, I'm so sorry. That will be Walmart's to begin with, and then slowly rolling out over the next 5 weeks to other pharmacies. Our pharmacy, Community Health Alliance, will also be allowed to immunize 65 and older starting next week.
So you're mentioning something just at the beginning about receiving the vaccine. So how realistic is it? How long will it take that to ramp up for the 65 to 70? And can you just say one more time, if I am 65 to 70, where will I be going? Which pharmacies? You said federal allocation. So can you just repeat again which ones those are likely to be?
Yeah, so the federal allocation should be Walmart's. And that does exclude Sam's Club from what I understand, because they are getting state vaccine and focusing on 70 and older right now. And also our pharmacy, a Community Health Alliance, you'll be able to, if you're 65 and older, starting next week, we'll be rolling that out as well. And as I said, that's based on vaccine availability. If you want to go into that right now.
Sure,
Yeah.
if you want, yeah.
This week, because of all the storms in Dallas, and one of the main distributors of the vaccine is located in Texas, we have not received our weekly allocation. So we're scrounging together to try to get enough second doses to administer to those people that we served 4 weeks ago. And I know there's a lot of other organizations in the community struggling with that as well. We were supposed to get our shipment today. It still has not arrived. So I'm hopeful for tomorrow, but that's kind of what our big holdup is pending vaccine availability. And now not only do we have the demand nationwide, we have Mother Nature working against us too.
So I saw on that slide, 40% of people had had their first vaccine, and from my understanding, they would have been given a date for their second one. And if it
Correct.
falls during this week, will they be notified not to come in because we don't have it, or how will that work? Do you know?
They would. Most likely, a lot of notifications are going out via text and via email, so I would keep checking that. Thankfully, we do have enough doses now. We've partnered with some community partners as well as the health department to be able to get enough doses to serve the people that we served 4 weeks ago, so about 600.
Okay, wonderful. And then we're going to talk later about the different places to go and get on a wait list
Right.
for being vaccinated, some resources, and they're on the handout, in fact. So well, let's just cover a little bit about that now, Jen. So as a senior, how do I go about getting vaccinated? How will I be find out that I'm due to be vaccinated?
There's a lot of different websites you can go to. I think having access to the internet is a very important thing. It seems to be that all of the ways to sign up through many of the local pharmacies is via internet or via email, to be able to email someone and get on a list. So if you don't have an email, I would strongly recommend finding a friend, a neighbor, any kind of relative that might have access to an email. It does not have to be your personal email. It can come from anyone. You would typically send an email or sign up online. Renown has, you create something called My Chart. So once you put in your information, then they would give you what's called a ticket. And once vaccine becomes available, you can cash in that ticket to schedule an appointment. Walgreens is very similar. You have to create a profile, so that way they can make sure that you qualify within that general population. So 70 and older, if that's what they're focusing on, and then dropping down to that 65 point if they receive the federal allocation. Thank you. Yes, thank you. Renown Health, and then the Washoe County Health Department, you would need to send an email to get on their list. They will then plop you into an appointment time once vaccine becomes available, and they will send you an email notifying you of when they would like you to show up. Community Health Alliance, which is where I work, we have an online portal. We don't require that you sign up for anything. As soon as appointments become available, and it can happen daily just based on when we get our vaccine allocation, we open up appointments and you just sign up. And all we need is your date of birth. So if you do not qualify based off of age, which is what we focus on, then we will call you and cancel your appointment. We really are trying very hard to be diligent about keeping those appointments up for seniors. Smith's, I did not have time to check into. Walgreens, like I said, you do have to create a portal, and then you can search vaccine availability. The VA, you have to be a patient within the VA healthcare system, and they are serving 65 and older. And Walmart, they will start next week, and that is online only, and you would have to sign up just similar to Walgreens and go through their patient portal, and the same with Sam's Club.
Right, thanks, Jen. And what Jennifer was just looking at is actually on the handout. For those in the room, it's on the back page of the handout, page 2. And for everyone at home, we'll grab you a handout. For everyone at home, that link that I mentioned that was in the email that went out this morning has the handout. And again, on the second page, you will find everything that Jen just went over and more information. And if you can't find it, you'll get another email tomorrow or just call us. And so if I can jump over to you, Dr. Anderson, I wanted to know, should I be hesitant about going and getting getting vaccinated? So I noticed there was a number of people on the survey who for one reason or another, don't want to get the vaccination, or at least not at the moment. Should I be concerned about it? And what are some of the reasons why people may not wish to get the vaccine, rightly or wrongly?
So in short, no, you shouldn't be hesitant. I think a lot of people's reservations is there's a ton of misinformation about this being a rapidly developed vaccine within a year, and is it safe? Have we tested enough people? And the truth of the matter is the mRNA type vaccine has actually been developed and tested for over 20 years, and it was designed exactly for this. The ability to insert a replicant of the virus to be able to develop this vaccine into kind of a ship, so to speak, that's already been tested is used for a pandemic scenario. So this actual type of vaccine has been developed for other coronaviruses like MERS, SARS, either other types of viruses like Ebola. If Ebola had spread more rapidly, they were able to insert this quickly and be able to develop it and get it out to the public in very short time. So it's a very safe model, and the actual spike protein is synthesized. You're not getting any part of this virus. So the testing that you would expect for other ways to vaccinate isn't needed because we've been doing this for about 20 years and have tested it in multiple different scenarios. With this particular set of vaccines as well, the trials that have gone on since COVID began, they had this developed within a month of discovering the virus. Tens and thousands of people have gotten this vaccine in these trials in multiple different scenarios and countries and all kinds of demographics that have shown that it's very safe and it's very effective, even more so effective than many other vaccines that we've been using for decades.
So why are people hesitant? What are some of the reasons?
I think that's the one reason where it seems like it's rapidly developed. How could we do that quickly? I think another one is, am I going to get very sick from this? Am I going to have long-term effects, which is something we can't totally predict? Is the vaccine going to cause problems long-term down the road? I think people are hesitant to get out of their homes into environments to get the vaccine. And I think there's been so much misinformation, and it has been such a rocky year, and we have had to change how we've thought about this virus so many times that it's hard to believe that, okay, this is the safe thing to do when things have changed about COVID, whether it's social distancing or whether it's a real threat or whether the treatments are working, has changed week by week. And I think it's frustrating to providers like myself, and it's frustrating to the public to not know who to trust and not know what information is true when it's so rapidly changing. And what I'd like to say is, fortunately, this has been tested and vetted for years before COVID-19 for this exact time, for when we anticipate that a global pandemic would happen, start killing thousands of people, and we needed to act quickly. That's why this was developed, and that's why it's been such a strong process before this year.
Thank you. Thank you for that great explanation. That makes a lot of sense. So appreciate that. So you're giving vaccines, Jan. You're actually sticking needles in your team in people's arms.
Yes.
What can we expect if we decide to go along and get vaccinated?
I think there's a couple different ways I can answer this question. First, if you are just a general member of the public and have never been exposed to COVID or tested positive for COVID-19, with your first dose, you're going to have mainly some arm pain. Usually people do not experience any kind of significant side effects. And by significant, I would say sometimes you would get a headache or flu-like symptoms, but that's generally with the second dose. When I received mine, I was fine with the first dose. I had some arm pain, but that's common. I mean, we're penetrating your deltoid muscle with a needle, so arm pain is very normal to expect. With the second dose, I had some fatigue for about 24 hours, and it was pretty significant. I still went to work. I never spiked a fever, no headache, no nausea, but a lot of people do experience those types of symptoms. If you have tested positive for COVID, what I experienced in my second dose, people would experience in their first dose because that's considered their second exposure. So typically they would have flu-like symptoms for 24 to 48 hours, very, very common, very expected. And then their second dose, that they're absolutely fine.
So just on that, if I've had COVID, I should still get vaccinated? Is that what I'm hearing?
Yes, if you've had COVID, it depends. I retract my previous answer. If you've had COVID, there are certain instances in which you would want to wait. That would be if you were treated with certain things in the hospital, if you were hospitalized due to COVID and you were treated with monoclonal antibodies or convalescent proteins, you would know for sure if you were treated with one of those. I don't think it's very common now that they're doing that. What do you?
Yeah, so there wasn't a strong allocation of it, so a lot of the hospitals didn't get many of those type of therapies, and some of them are designed actually for patients to go home so they don't get to the stage in the hospital. So it's few people have actually received it likely, but we have given a significant amount of doses, and we're warning people about that with the vaccine you should wait because you're going to interfere with that antibody response that you'll get from the vaccine. So you should always just talk with your physician or whether you would qualify if you've had COVID, and they will run through some of the things to look out for.
Right. So typically there's about a 90-day washout period if you had received one of those treatments. Other than that, once you're past the quarantine period, if you had a mild case, the CDC recommends to receive the vaccine.
Okay, thank you. And then have you noticed, because you've been administrating to people 70 plus as well as younger people who, police officers, fire department, in-home care, and so on and so on. Is there a difference in terms of the way people react to the vaccination based on basically age?
Yes. So we have been doing a significant amount, as I said earlier, second doses. So we've been getting a lot of feedback on how people have felt after the first dose. Generally, we see the older you are, the better you tolerate the vaccine. So quite opposite of the disease, right? The people in their 20s are having a hard time, especially with that second dose. The older people, nothing. Hardly even arm pain, which is quite amazing. They can tolerate it very, very well.
And that goes along with the studies as well. So all the vaccines have showed a predilection for younger people having more and worse side effects than older people. I think we were joking that maybe it's a generational issue and it's not so much the actual side effects. I tend to
Wimpy young people.
lean towards that. And I would just say, expect to have side effects. Greater than 80%, any of these vaccines had either local site injections or systemic side effects. They're generally short-lived, but you will feel, flu-like symptoms. It's very likely you'll have that within, a few hours to a day from getting the vaccine, but it usually resolves very quickly for most people.
And what about any precautions prior to get vaccinated? Should I be taking some pain relievers before, after? Anything to share with our audience on that?
So we don't recommend that you want to pre-medicate. Obviously, if you are experiencing arm pain, headache, body aches, you would want to treat that fever. You would want to treat that post. So ibuprofen or acetaminophen, which is Tylenol, those are absolutely fine to take if you exhibit symptoms after the fact.
We theorize that ibuprofen, Tylenol, antipyretics, or anti-fever medications may blunt that immune response, and that's not what you want. But after you've gotten the shot and you have the immune response, certainly find a treat. We want you to be as comfortable as possible. But beforehand, we don't want anything that's going to decrease that response and for you to get fully immunized from the virus.
And when will I be fully immunized? Is it the day I get that second shot, or as soon as I got the first shot, I'm good to go? Or can you tell us a little bit about that process as to when it's safe to be less cautious, I guess, maybe?
Yeah. Do you want to?
Yeah, sure. So most studies, 2 weeks is the safe zone from the second dose. So first doses, depending on what type of vaccine, have some effectiveness, sometimes very high effectiveness, but it's not complete. So the second dose, which you receive 2 to 3, sometimes 4 weeks later, confers that larger amount of immunity. But from that, it would be about 2 weeks is the safe bet to say, okay, I'm likely fully vaccinated. But this is not 100%. So there is a chance that you may not become fully immunized from it, just like with any vaccine, nothing is 100%. So we advise you to continue all precautions because we still don't know if you are fully vaccinated and immunized, whether you can still spread the virus. We don't know that. And it's likely that in some ways you can. So we're recommending continue all precautions until we can have some more information. We'll definitely get the vaccine and expect to feel fully immunized and safe at home at about 2 weeks.
Okay, great. So what I'm hearing is we still need to take precautions. I've heard people say, well, I've been vaccinated, or I'm going to be vaccinated, and I don't need my mask. I can go partying, go do all the... That's not quite the case.
No, we do not recommend that.
No, okay. Just want to make that clear for everybody. And then does it matter which vaccine I get? Whether it's the Moderna or the Pfizer, should I be concerned I'm getting one over the other?
Initially, it doesn't matter, but for your second dose, it does matter. So for example, if you receive a dose of Pfizer vaccine, you cannot receive your second dose with Moderna. Those are not interchangeable.
They're very similar. Get whatever vaccine you can get first. So that's the idea. There's such a limited supply that you want to get whatever you can first. so you can get in line and do that, and we can start vaccinating other populations once we get our higher risk populations done.
And when we were talking last week, we kind of I joked about getting the vaccine multiple times, because then I could get to 100% immunity. But you pointed out why that would be a really bad idea.
Yeah, don't do that. One, you should have the same type of vaccine for both. So you need to follow the recommendations you get. And it is creating a large immune response. So if you were to get multiple vaccines, 2, 3, 4 vaccines, you could have some serious life-threatening effects. And actually, from some accidents we've heard about and researched, that people getting many doses accidentally because the vials were not diluted down, that there were deaths from that. So it is not a deadly vaccine, but like with any medication, if you take much more than you're supposed to, that's when the harmful effects happen. So just get your second dose with the same type of vaccine that you got, and you'll be perfectly safe.
And I know you kind of touched on it earlier, but is there any reason I should be waiting until there's full FDA approval on these vaccines, given everything was rushed, and you talked about the history of it, and it wasn't really rushed, but I know some people are kind of hesitant. I want to wait till there's full approval. What would you say to that?
I would say no. And I think now we've kind of hit that threshold with nationwide, there have been so many vaccines administered. We've definitely hit the point to where more would have, than what would be in a normal clinical trial over 3 to 5 years. Yeah. And the CDC is tracking through a program called vSafe, all types of side effects. Every patient that gets a COVID-19 vaccine is encouraged to sign up. It's not mandatory, but it's highly recommended. They'll check on you daily. They'll send you text or emails. They'll ask you what type of side effects you're exhibiting. And that's their way to kind of hold those manufacturers accountable for what they presented in the emergency use authorization. And then also us as medical providers, if you were to come to me and said you had a side effect, it's also our responsibility to report that as well. So.
Yeah, I would agree. I think the emergency use authorization is still very difficult to get to. As with many things in the government, any process takes a very long time. So that full approval is a lot more paperwork and a lot more things that are not necessarily vital to the safety of this. So the primary points of the safety and efficacy have been done. The other parts that the government has to go through take a lot longer. But to get this emergency use authorization and the support of clinicians and pharmacists and scientists all over the world takes a lot. So it is very safe. I would say there's no reason to wait, and they will get that authorization. It's just it's in non-clinical hands to do that. So.
And I think a good way to compare this, as a pharmacist, I have people ask me all the time about over-the-counter recommendations. Thank goodness we have the FDA, which this vaccine has been vetted by. All of the vaccines have. When you purchase something over the counter, any kind of vitamins, those are not vetted by the FDA whatsoever. And so, people are never hesitant to say, I want to take this vitamin C. There is a program called USP that people can submit to on their honor, and they check it for efficacy and safety. But just kind of a good comparison.
Yeah, good point. And then I've heard some people mention, say that they're going to wait to one of the future vaccinations, like the Johnson & Johnson, and it's going to be a single shot. Mm-hmm. And correct me if I'm wrong, I don't think the effectiveness of it is as high as the current to Moderna and Pfizer. So what would you say to people that are like holding out because they just want one shot or whatever the case may be? So I'm getting signals from the back of the room. We'll ignore them for the moment.
Okay.
So should I hold out and wait for a future one? And
I would say no. If you have the ability to get it now, I would get it now. Like Dr. Anderson said, these are 95% effective. The newer ones are 65% effective against the virus and 85% effective at hospitalization. So a severe infection from COVID-19.
So correct me again if I'm wrong, if I was to hold out and wait, I may end up getting a vaccination that's less effective than what I'd get if I went today, just based on what's then available at that point in time. Would that be correct? Correct.
And 2 other points. One, there's no guarantee that vaccine is going to come to this area or in any major fashion. And 2, you could get COVID and get very ill or maybe even die in the meantime. So waiting for a vaccine that you might think is a little easier to get is not worth it. And some of the vaccines that we have now, the first dose is just as effective as that single dose. The second dose is much more effective. So we're seeing some of these other vaccines that are coming out, they're less effective. They're less effective against a lot of the new variants. And again, there's going to be a delay in getting those, and we don't know who's going to get them and where and when. The distribution is not within our county's hands. We do a great job here getting the vaccine out. We've gotten out almost all the doses that we've gotten, much better than, I think we're in the top 3 or 5 in the country as far as distributing the vaccine, but we're not getting a lot of it. So we'll get it to you as soon as we can, but you need to take every opportunity to get it so we all can go back to normal, and maybe we can start having meetings in person here soon. If that's, your primary driving force, whatever it is, get the vaccine so we can get back to normal.
So I'm just curious, do either of you know how many people have been vaccinated here in Washoe County or Northern Nevada?
The governor said recently, and this is last week's information, we're close to 40,000 in the north. I think 300,000 to 400,000 vaccines have gone out in Nevada, but most of them have been Southern Nevada. With good right, larger population, sicker population, those hospitals are completely overrun right now, unfortunately. And we've done a good job in our community here. Therefore, we're seeing a little bit as a less of a need because we've done a good job following the rules and making sure our family members don't get sick and taking care of each other. So we're getting a little less of a distribution up in the northern part of the state.
Thank you. Sorry if I'm a little distracted. I get hand signals from the back of the room and I'm not standing on the imaginary X, so I'm in the camera shot. So help me here in the room if I stray, just point that I need to move back over into camera shot 4 or whatever it is. So I just wanted to follow up on that and just ask, are there any situations where maybe I don't want to get vaccinated now or I shouldn't, that I should be waiting? So you kind of touched on, both of you, if I'd had COVID, then, a 90-day period. Are there any other circumstances where I should be concerned about an allergic reaction or some negative reaction?
And just to correct you, having COVID is not a reason not to. It's more if you've had any of the monoclonal antibody treatments or convalescent plasma or some of these more advanced treatments, which is rare that people are getting those to do that. But if you've had COVID, I would just say always talk to the provider or whoever's giving you the vaccine and let them know that information. I think Jen was going to talk a little more about some other reasons not to.
So if you've had an allergic reaction to a COVID vaccine in the past, so that would be more your second dose. Or the thing that I've been running into a lot with seniors is everyone seems to have gotten their shingles shot. So that would prevent you would have to wait 14 days from getting any vaccine before you could get your COVID-19 vaccine. And that's on either end. That would be one of the preventative.
So if I've just been vaccinated for something else and I need to get my shingles shot, I need to wait a couple of weeks.
You need to wait 2 weeks, correct.
Okay. And any other reasons? That's pretty much it.
There is, I'm going to have to look at my notes.
If you've ever had a severe anaphylaxis type reaction to other vaccines in the past, you should consider not getting it. But we would say any allergic reaction to an injection vaccine, just discuss it with your provider, because there's some things that can be more local or specific to a preservative or something that's in a different flu vaccine or the shingles vaccine versus this one. So just discuss with whoever's giving you the vaccine or your provider what those reactions were, and just consider that and just make sure it's apparent that you've displayed that. But almost always, unless you've been having a severe reaction to this particular vaccine, you should be fine to get it.
Okay, thank you.
Polysorbate is the other component.
Polysorbate.
If you have an allergy to polysorbate, then you should not receive it.
That's not like sorbet I eat for dessert?
No.
No, not related?
No.
Okay. So what's polysorbate in? I'm just curious.
That's just one of the contraindications.
Okay.
It's a component of the vaccine, so
it's part of the preservative solution. And I've never even heard of someone having that allergic reaction. I mean, it's a very common molecule in many products in your body and things like that. So, but if you have had it, you probably know.
You would know.
You would know.
And we always try to, again, if you have that reaction, you talk to your provider and they will try to correlate what that reaction was to and if it's in this vaccine. But what's really nice about this vaccine is you hear about older vaccines that have things that are derivatives from eggs or other products, that this doesn't have much of that. It's very clean, so to speak, in the drug, that you're getting a very specific, and it doesn't have a lot of other components that you might be allergic to.
And they designed that, and that's hence the reason for the stability that we then run into. That's kind of the trade-off component. So they wanted to be able to offer the vaccine to so many people and try to decrease that allergy profile, unlike the flu shot. And by doing so, the stability requirements for storage are the trade-off.
Keeping it nice and cold.
Keeping it nice and cold.
Versus putting eggs in it. Okay.
Yeah.
Okay, thank you. And then I just wanted to ask you both about the term some of us have heard or read about, long haul COVID. So obviously we're recommending people should be vaccinated. And even if we are still susceptible, a certain percentage chance of getting it. Why is it important to try to avoid getting COVID from what you've seen and experienced when we talk about this thing called long haul COVID? What is it? What does it mean? What are the implications?
Yeah, so after having COVID, if you've had it and you've had a decent response and felt ill with it, it's horrible. People feel really bad. And again, people are dying from it in high rates. So beyond that, if you get through and you've cleared the virus and you're testing negative, a lot of people are feeling these long-term effects, fatigue, body aches, shortness of breath, even chronic cough for weeks to months, some people even years after. Some people have not regained their taste of smell or taste. This is about 10% of those who get it. There hasn't been any indication that these things are life-threatening, but they can be debilitating. And this has happened with other viruses and illnesses. We don't totally know why. We know that COVID-19 affects the nervous system. It does get into your cranial nerves, which are in charge of your taste and smell, causes inflammation in all parts of the body. We anticipate that these things will fade over time and that percentage will go down, and many will be rare that have lifelong effects, but we can't really predict that. So preventing the disease is the big point if you haven't had it, because you don't want to have that, especially if you're in the older generation, you don't want to spend years feeling fatigued and not feeling well after getting this. So that's why we're really stressing getting the vaccine, regardless if you've had it. And we're not showing anything that would stipulate, especially based on the physiological studies done on the vaccines in the past, that there's any reason why the vaccine would cause any of those effects. We really don't think that would happen.
Okay, thank you. So I want to talk about travel next, but before we jump to travel and what we kind of need to know, is there anything else we want to cover that I left out?
I think so.
No? So let's talk about travel, because I know a number of attendees have sent in emails and questions. What we need to know to travel. I want to travel somewhere, and some places require testing before getting on an airplane. If I want to go to Hawaii, I need to be tested. So I guess the first one on that is testing. So if I need to be tested, where do I go in order to get on a plane?
I think that depends on where you go. Like you had mentioned Hawaii. Hawaii has very specific travel partners that they require a COVID test from, and you need to complete that 72 hours prior to even getting on the plane and have your results in hand. Otherwise, they will not let you on the plane. Depending on the island, they will require a secondary test within 72 hours after arriving. Some will make you sign up for contact tracing so they can make sure that if you do become positive, they know everywhere that you've gone. To get back into the country, the CDC is now recommending that you get a test prior to coming back into the United States. I haven't seen anything from other countries requiring that to go, but definitely to come back into the United States, you need to have a COVID test. And most resorts will, because they want you to go, will help you get that, at least that I've seen in Mexico. I haven't seen anywhere else that would do that, but the all-inclusive ones seem to be offering that as.
Yeah.
So that'd be a good thing to check, though, if I'm going to some destination overseas, to make sure there's somewhere I can get tested so I don't have to travel somewhere else first in order to get back here.
Right. And we're still recommending no unnecessary travel, but we understand some people do have to travel and there's events and things like that going on. So if you do need to travel, not only check ahead of time, but check days before, because things are changing by the week, state by state, nationally, internationally. We're seeing things change all the time. So when things spike, you may have something that changed from previous. So the CDC website and the government website for travel, if you search those, you should be able to see what those requirements are for those areas, and contacting wherever you're staying and just double checking. Usually they're good about letting you know if anything changes. I will caution people that there is so much testing that's being developed, and you'll see more and more tests that are coming, home tests they're starting to promote now, tests in non-clinical, non-medical settings that are coming out that are not very sensitive, meaning you could have a lot of false negatives. So if you could have COVID and it tests negative and feel very confident, I would not rely on any of those tests as a true indicator. Even the tests we have in the hospital are not the best. They're not what we would like them to be. They're much better than a lot of the commercially created ones that you'll see. So if you can get a test from a healthcare provider, those tests are much more reliable and safe versus some of these other ones that, I mean, we're seeing, 30, 40% sensitivity, meaning there's a 60 to 70% chance you actually have COVID, even though you have a negative test. So I wouldn't rely completely on, if you go to the airport and there's a vending machine, I wouldn't quite rely on that one, but it may get you on the plane.
So if I'm trying to be careful with my family and I'm traveling to see them, getting the kit off Amazon or at the airport's probably not, I shouldn't have a high degree of certainty that.
Exactly, correct.
Okay, understood. What else do we need to know about travel? Anything else we can add? Talked about airport vending machines, home, pharmacy tests. Anything else you can think of that people should know?
Just to continue social distancing, wear your mask and wash your hands.
Okay.
Yeah, and just I know it's been a very long, over a year now, and everybody wants to get out, but every spike, every major course of deaths that you've seen has been related to either opening things early or travel. So just be careful. It won't be that much longer. We don't think that we can get this vaccine rolled out, by summer, maybe next fall, that things will be kind of back to where we want them to be, back to normal. So you have to be very careful, even traveling by car, touching things on the way, interacting with people accidentally. There's so many ways. It's such an infectious virus that you really have to maintain that high level of protection and awareness if you're having to travel.
And do you have anything to share as far as the variants that we hear about being more contagious? Is there anything on that we should be aware of, or?
So
I don't know much about that.
Yeah, so I've been force-fed all this information, so I should know a little bit. All the variants that have come out, many of them have been shown to be more infectious. We don't know why. They just seem to be spreading a little bit quicker. However, none of them are shown to be deadlier or to cause more harmful effects. And for the current vaccines that are authorized right now, they are still effective. So the variants haven't changed much in how we're thinking, just that we should still be precautious for communities that haven't experienced widespread exposure, that if it does get there, it's going to spread a lot quicker, probably quicker than, it's spread quicker than we could manage already. And if it's spreading even quicker than that, then everyone's playing catch up. So the last thing we want is to overburden an already overburdened system and healthcare system by maintaining those precautions. But I wouldn't be terribly scared of the variants now, and I wouldn't be worried about the vaccine not working against those. And there's a chance this may become a seasonal thing like the flu. So, getting the vaccine out now is a very good thing because it's a new virus and there's a chance we could eradicate it or at least diminish it down to very minimal levels. But we could expect that maybe we get a yearly vaccine or a bi-yearly vaccine in the future. And hopefully we've gotten things under control by then.
Thank you. Great information. So is there anything I haven't asked you that you want to share before we open it up to the questions from the audience?
I don't think so.
I would just say, and this is one of the hardest things that people to really think about, is with the vaccine or with all the precautions we're doing, it's not just about you. We have a lot of young, healthy people that think, well, if I get it, I'll be fine. And we're not as worried about you. We're worried about the person that you give it to, or the person that you give it to, and the next person, and 4 people down the line might be someone's grandmother or someone's relative or someone's child that gets extremely ill. So when you're doing these things, I know it's harmful to you. It seems so restrictive to wear a mask and not be able to do the activities you want to do in this great country of ours, but you're protecting other people. And that's what's hard to see, is that you don't see it. Maybe you don't see it in your community or home, or you're a student, you're not exposed. But as someone that's watching people die on a daily basis, watching people be extremely ill, being torn from their loved ones and having to sit in the hospital alone and being cared for in very scary settings and often dying sometimes in our hospitals, you don't want to be responsible for that, and you may never know. So just think about the person next to you or someone else in your family or life that you care about, and try to take those precautions for them and not just for yourself.
Yeah, well said. Thank you. So I've just put up on the slide here the resources that are in your handout. Is there anything we need to touch on those? I think most of them are self-explanatory. We've listed out the places to get immunized. And again, they're on the handout. And as you said, Jennifer, most of those are online. We did provide phone numbers, but I think you shared, Jen, that it's much easier online than trying to call through. Mm-hmm. Yep. And there is a Washoe COVID hotline if you are having trouble or need help. That's up there on the screen. And again, it's on your handout. So Alexa, could you just put up the poll for the next seminar, just a bit of housekeeping. So on March 4th, we have a community virtual tour of 5-star premier residence here in Reno. It's a independent living, assisted living community. So if you'd like to find out more, over the last several months of last year, we toured, I think, 4 or 5 communities virtually. And now we have the pleasure of getting to see 5-star. And actually, we did a bus tour there, I think, 2 years ago, which was a lot of fun. But for those who haven't seen it, yeah, please join us on March 4. So just on the poll that should have just popped up on your screens at home, you can just indicate if you'd like to attend that. And then on March 18th, yeah, we have the truth about aging in the best place. So we're going to talk about all of the issues as we age, what the various different options are available to us, how we can make changes to our existing home as we age, and what other options we might want to consider for a whole range of different reasons. So that's on March 18th. And again, it will be here in the room and also via Zoom. And for those who are in the room who would like to attend, you should have a yellow page, an evaluation form, and somewhere on that, there's a box that you can check if you'd like us to pre-register you for that seminar or for either of them. One last thing I meant to have a slide on. A lot of people have asked about all the past seminars that we've done over the last, I guess, how long we've been doing this? 5 years, I guess it is. So on the retiredlivingtrueseries.com site, up on the top right-hand corner, there's now a link that has past seminars. And our team have been busy putting up all the past recordings, handouts, notes, and so forth. So you can access those there if you want to go back to one of the seminars in the past or even today's seminar for that matter. And yeah, let's jump over to questions. So let's start here with the audience in the room. If anyone has a question, feel free to walk up to the microphone here on the back right-hand side so everyone can hear you. We want to be able to, the audience on Zoom, to be able to hear what the questions are and our panelist responses. So Kerry's jumping up and it's going to just make sure that microphone is on. Alexa's balancing the cameras so everyone can see at home what's going on. So Kerry, fire away with your question.
So the way a vaccine works is it stimulates your body to produce the antibodies against the disease, right? So if you think you might have had it already, but you haven't been tested for antibodies because it was a mild case and you didn't go to the hospital, so you may already have the antibodies. And then if you get the vaccine, are you going to get an overdose of antibodies and then get a terrible reaction to the vaccine?
No, the short answer is no. So the problem with this coronavirus is it stimulates a very strong early immune response, that B cell response. But those B cells develop antibodies that just fight off what's going on at the time and cause all the side effects. However, it doesn't convey a long-term T cell immune response, which is what gives you that sometimes years, sometimes lifelong immunity from things like measles and mumps and other vaccines that you've been given. So the vaccines very specifically cater to develop that long-term response and a good immune response to have a longer effect. So unfortunately, when we studied people that did have COVID, at about 90 days, their antibodies were virtually undetectable for most people. So it's not triggering that long-term response. We don't exactly know why. It does get into the spleen, which is very important for the immune response and has effects there, and maybe that's why. But it's not doing what we would expect with other viruses where you got it and you should be immune for a long time. It's just not doing that. That's why you see second cases. And also, the vaccine will prevent less severe effects. Even if you do get COVID and it didn't work technically, you're going to have a much better course if you had the vaccine.
Thank you. Annette, you have some questions for the people on Zoom that have typed them in. And for those who are at home, if you have a question, you can either raise your hand on the Zoom interface. There's a raise hand button. If you click that, we'll know that you have a question. We can unmute you, or feel free to type into the Q&A box your question and one of the team will read out the questions. So you have a question from someone, Annette?
Yes, I do, from Michael. Is there any data available online to see number of vaccines given per day or past 7 days, number received past 7 days, number expected in the next 7 days, etc.? Also a chart of number received by week for the past 60 days to see progress.
Who would like to take that?
I know there is, so we input our data on the Washoe County Health Department webpage. And so if you go there, you can see, I know most of the medical centers that are administering vaccines I saw on there, it's just a question of how up to date it is, right? So if I'm out giving vaccine 5 days a week, we're required to report a lot of data. Everything, if you've gotten a vaccine that you fill out on the questionnaire, all of those boxes that you need to check, and it's front and back, it's 2 pages long, we have to report to the CDC through a system called REDCap. So it is very time consuming. We did just finally catch up. We've been doing vaccines for about 6 weeks now, and we finally got everything caught up. So we just submitted our data. So how real time it is, that's going to be the difficult part. You know, when you're out there doing it, a lot of the people, so I'm responsible for submitting all that, but I'm also responsible for administering vaccines. So I'm out there actively giving vaccine. And to me, that's more of a priority than inputting data.
The
Great,
Washoe
thank you.
County, if you just search Washoe County COVID-19, the first thing that pops up, they have a very good dashboard. You have to notice that there's multiple pages, so there's a little arrow on the bottom right to see the rest of the data. So it is limited. I don't think it's as detailed. I mean, it'd be great if we had all that information that you're describing. And then the predictive model of what will happen in the future is near impossible because we have no idea what we're getting week to week, much less months ahead of time. But there is good information there, both on how the county and even nationwide is doing with case counts, hospitalizations, vaccinations, all of that stuff is on there. It's a little delayed sometimes, but it is good information that you can find.
And there's a dashboard, if I'm not mistaken, for both, for the state and then for Washoe County. And then somehow I signed up on an email from, it must be Washoe County Health, because every week I get an email from them and it tells me exactly how many vaccinations were administered in the past week, how many second vaccinations, the total vaccinations, but that's for Washoe County. So I'm guessing if you go into Washoe County, there's somewhere there you can sign up and they have a good update that comes out every week that talks about what's happened in this past week. Another question, Annette, from our Zoom audience?
We do. We've got one from Brandis, I'm sorry. Does the cost of the vaccination, if any, depend on your insurance coverage?
So all of the vaccines are supplied by the government at this time, so there is no out-of-pocket cost to you. If we do bill your insurance, we're billing an administration fee, which they cover 100%. You will not be charged anything to get your vaccine, first or second dose.
And I have a question from Donna. If I am exposed to COVID after 2 weeks, safer second shot, what are the chances of me getting sick with COVID? I'm not sure what she refers to that. If I'm exposed to COVID.
The second shot.
Correct, yeah. So we're recommending, it's probably a little sooner than that, but it's 14 days is the safest after the second shot that we would say if it worked, you'd be fully immunized. With the Pfizer and Moderna that we're distributing now, it's 95% effective. So roughly a 5%, maybe slightly more chance that you could still get COVID. But of those, your systemic effects, how your response is, how sick you get, mortality and death from that is much lower even if you do get COVID. So hopefully that answers that question.
So just so I understand, so even if I get COVID after being vaccinated, the impact is going to be less severe than,
Correct.
probably less likely to die from it than
Correct.
without the vaccination. And then is there any effectiveness from day one of the first vaccine? Is it kind of building up in my system, I take it, through to 2 weeks past the second one, or do I have nothing until I get that second one?
You would have some immunity after the first dose from either vaccine within that 2-week time frame.
We just don't know how much.
Just don't know how much.
Yeah. Okay, so got to be careful. Great question.
Okay, this one's from Audrey. My sister-in-law had COVID and continues to experience COVID mouth. Her tongue is swollen. She has ulcers in her mouth. She cannot speak clearly, but sounds drunk. Today, she will be seeing a dentist to see if there is treatment for it. Do you know anything about this?
So the issue with viruses is when you get one virus, no matter what it is, you can have other viruses or bacteria. So people can get, the flu and then they get pneumonia later down the road. So your immune response to other viruses and other pathogens is diminished if you are sick. So it may be that she got a different virus that is causing those mouth sores. That's not a typical thing for COVID. Maybe the inflammatory response caused an inadvertent effect with that tongue. So if she's having those troubles and the dentist is not entirely sure, we do advise you to see a medical provider quickly, make sure they're not missing anything dangerous. And it's really difficult to say without seeing the patient and knowing the whole history. But frequently you do get those secondary infections after an illness.
Thank you. And just before you go on, Annette, I just want to remind our people on Zoom to please, raise your hand. Do we have anyone, Annette or Alexa, that has raised their hand that we can unmute? Because I really want to test out our sound system. It'd be great to get some live questions from the audience, if at all possible. So let's jump over to Claudia. Claudia, we're going to unmute you, and you're now unmuted. Please go ahead and ask your question.
Okay, now am I unmuted?
Yes, Claudia, we hear you loud and clear. Isn't this technology cool? You're at home, we can all hear you. That's fantastic.
It's fascinating. I had a Moderna vaccine on the 3rd of February, and I did have some reaction to it, but 10 days later, I had a pretty significant reaction, which has been diagnosed as delayed cutaneous hypersensitivity, which I'm wondering if the doctor has heard of. Apparently it's quite rare. It's only from the Moderna, and it mostly affects women. So that I've had since Saturday. The rash now is about 6.5 inches by 3.5 inches and very itchy. It's been being treated by my physician. But have you heard of this? And what do you think? I'll get a worse reaction for my second vaccine or a lesser reaction?
I'm guessing this question wasn't directed to me. It must be for you, Dr.
It was
Anderson.
for the doctor.
It is extremely rare, and I would applaud your physician for catching that. Rashes are extremely difficult to diagnose, and catching that is rare. It is so rare in general, plus even more rare with this vaccine. I couldn't tell you if you would expect that. We are seeing that people do have reactions to the first, do have reactions to the second, but it's usually that kind of flu-like illness feeling and not a localized response like you're having. Your provider sounds very savvy, so I would recommend you listen to them and sometimes some topical steroids in some time, and it'll get better. Fortunately, again, with that first dose, you're going to get some pretty decent immunity. It's not perfect. That's why we have the second dose. But you did get some pretty decent immunity from that with that unfortunate local reaction that you had. So I'm sorry you had that.
Is it localized to the injection site?
That's like down on that 1% list of.
Yeah. It is from my shoulder to my elbow, basically, and then some discomfort going down my arm, and everywhere that I have arthritis, I'm getting an arthritis response.
I've seen that same rash in 2 other people, but the good news is it will go away. So, and the arthritis, there's been a lot of complaints about the vaccine aggravating joints that have previously been aggravated. If you've had like an old knee injury, we've had a lot of complaints about that. Just common things feedback that I've received from patients that have gotten the vaccine. But the rash only happened with 1 dose in both the people that I know that got it. They did not get it for a second time.
Well, that's encouraging. Yeah.
And do those symptoms go away, or the inflamed arthritis where I've had it, that dissipates over time?
Yeah.
Good. Do I have anyone else? Oh, Annette's she's got a question. Someone's typed in.
Oh, yes, I have several.
An audience here, if you have questions, feel free to go up and push Annette away from the microphone to ask your question. Don't let my wife hog the microphone.
Elza has this question. Thank you for a most informative session. Question, how do you know about the reactions people have after taking dose 1 and 2?
I know because I ask every single person before I give them their second shot to see how they reacted. Also, I was in charge of giving it for all of our employees within our health center. So that was another 200 people that I was able to receive feedback in a variety of age ranges. So that's personally where I've gotten most of my information, is based off of people like you that give it back to me.
Do you want to mention Be Safe?
And you can talk about Be Safe and Be Safe.
So there's an application, I'm not as familiar with it.
Oh, yeah.
Called vSafe, which is where all these reactions can be inputted. So nationally, we can see how people are reacting to it. What I do know is that compared to the trials, we have not seen a significant variance. So what we would expect to happen is happening. So we're not seeing anything out of the norm. In fact, in a lot of areas, it's going better than what some of the trials had shown.
Yeah, so when you get your vaccine, whoever you receive it from should give you a paper with either a QR code on it that you can scan with your phone, or you can go to the CDC's website, and it's V as in Victor and then SAFE, S-A-F-E. And once you receive your vaccine, then you can sign up you will get text alerts or emails, and they'll check in on you, and they'll also remind you when it's time to get your second vaccine. So if you forgot what brand you received, they'll remind you at that 21, 28-day mark to get your second shot.
And if I do have adverse symptoms, whatever, I can record it there.
It's just clicking a button. They make it very easy.
Okay, great. Excellent. Thank you. Good question.
So quick question, guys. And I've
Who's asking the question?
sorry,
Who's this handsome gentleman up here?
My name is Vic, and I'm with Amada Senior Care here in Reno. We do in-home care. So I'm typically the guy who goes into the home and does the initial consult with the clients and the families. And a big question they're beginning to ask us is, are your caregivers all vaccinated? Obviously, they want to know this. So I don't know if there's full truth to this or not, but from what I'm hearing is that even if you're vaccinated, the virus, if you contract, you can still contract it, you can still transmit it. Is it still transmissible once you have the vaccine and even the second vaccine? Or are you pretty much not able to transmit that virus to somebody else if you're vaccinated?
Jen, correct me if I'm wrong here, but we do feel there is a chance it still can be transmissible. We don't know how much or why or what actions are doing that, whether it's contact, whether it's actually in your system. So it is still transmissible if you do have it, which is kind of the trouble with it and why we want to keep maintaining these precautions regardless of the vaccination. So we don't really know exactly why, but we still think it is transmissible, but not nearly as transmissible as it would be if you weren't vaccinated.
So that's why I've been telling the clients or the patients themselves is better off you get the vaccine, get it done to protect yourself, as opposed to depending on somebody else coming into your home having the vaccine. That's probably the more 100%, safer way to go about doing that.
Yeah, that's a very good way to say it. And I think that's perfectly accurate.
All right. Thank you so much.
That was a great question, Vic. And Vic's one of our sponsors, Amada Senior Care, so we appreciate you. And I guess, sorry for my ignorance, but I could be immunized, vaccinated, but I could touch something and end up touching something else and still causing someone else to get it. Could I not?
Correct.
In theory,
Right.
less likely, that form of transmission, but yeah, so we just need to all still be careful, don't we, no matter what?
Mhm.
Yeah. So who has their hand up, Alexa? Mike. So Mike, we're unmuting you now. Please go ahead and ask your question. You there, Mike? Go, Mike. I think we can. We're not sure if Mike has a microphone at home, no pun intended. Yeah, please, Annette, go ahead actually I do hear sound. You there, Mike? Or is that a plane flying over here, a little rumble? Maybe it's a plane, okay. Annette, go ahead and ask.
Okay, Kathy has a question. Should someone be concerned getting the vaccine if they have an anaphylactic reaction to shellfish?
No. I've given lots of vaccines and
Speak
penicillin.
up, say that
Oh,
again.
sorry. No, I would not be concerned about that. We may ask you to wait around a little bit longer if you've ever had to use what we call an EpiPen or an epinephrine injection due to an allergic reaction. I've given lots of vaccine to people that have had shellfish allergies. I'm one of them and I'm still here. And penicillin, absolutely fine. Thankfully, we have not had any significant reactions, and we've given, I think, over 2,400 vaccines. So,
Very good. Annette, you have another one?
Nona has the question, if we are between 65 and 69, should we register with all the vaccine distribution sites, or can we rely on the Washoe County site to send us a ticket if we have registered only there? Can we go to any vaccine site after receiving the ticket?
So no, they're not interchangeable. So once Washoe County, I mean, once they open it up fully to everyone that is 65 and older, then you will be able to go anywhere because at your age. You do want to register with as many sites as possible. That's just going to increase your chances of getting a vaccine as sites become available and as sites get vaccine in. As I was talking earlier, there's multiple distribution allocations. Some are federally, some are locally from our state. And so those are two different systems that don't necessarily talk to each other. So I may get a federal allocation, whereas the state didn't give me any that week, or vice versa. So different entities are getting their vaccines from different places, and you want to have your foot in all of those options. And so that just increases your chance of getting the vaccine.
And Jennifer's saying that, and it's causing her life to be absolute chaos by promoting that, because it's very difficult for the organizations to know and, you know, call you, say, hey, you're ready for the vaccine. Oh, I already got it. So they get a lot of, she was telling me, a lot of calls like that. So we do ask that if you do get a slot, find out a way to pull yourself off those other lists, because it'll really help other people get the vaccine quickly. Because if you're on 5 lists, then 5 organizations are waiting on you or trying to find you, and you may have already had it. So please, for your community members, try to take yourself off that list as you can. But I agree, I do promote getting it wherever you can as fast as you can.
So maybe just keep a list. If you've signed up on all 5, know where you signed up. So after we've got the vaccine, we can go back to the other 4 and say, I'm good to go, rather than creating you extra work.
That's okay.
So I'm just curious, does that mess up the numbers as to how many people we think that need to be vaccinated because they've signed up? Are they like aggregating those 6 different places, thinking we need this many?
So it is hard to track person by person, but we do have a good number of knowing what populations and roughly what numbers. So if we say we have 100,000 seniors and we've given out 100,000 doses to people over 65 or over 70, we can feel a little better about it. So I don't think it matters as much, but it is extremely difficult to track person by person, just like the testing. You look at, we've had a million positive tests, but if someone's tested twice or, other reasons in poor data, may not be totally accurate. And I think all of us are a little less focused on the data at this point and more focused on getting it out and getting people better.
Perfect, thank you. Annette, you have another question?
This is from Kathy. If I sign up for vSafe with information about my vaccine experience, does anyone in Washoe County have access to getting information about Washoe County residents?
I don't think that they will narrow it down by county, not that I'm aware of.
Agreed, I don't have any knowledge of that being local.
You have another one, Annette?
From Judy, I have a family member who's bedbound and has multiple medical issues. Is there a home vaccine service, and is it dangerous for her to get the shot?
I don't see any danger for her getting the shot. There are homebound services. REMSA is actually they do homebound vaccine administration between 10 and 12 people a day. Their information could be found in your handout. There's the Immunize Nevada website. Thank you. And there's a link to how to get a hold of REMSA, and they will come to the house for bedbound patients.
Thank you. And I just forgot to mention, I see there's several people who are dialed into this call. They're not on a device, they're actually on their phone listening in. And if you have a question, you can press *9 on your phone and we'll be notified and we can unmute you as well. So I apologize for not mentioning that earlier. Annette, you have another question?
Yes, Maria asks, how worried should we be about the variances from other countries?
I guess I would ask for more clarification. Variants as far as how it's going to affect your vaccine, or the effectiveness of the vaccine, or how sick you would get if you got COVID from one of the variants.
Perfect, all three.
Yeah.
All of it? All of it. I'm going to have you answer the sickness part.
So the variants, all we've seen with any of the multiple variants, and again, this virus is mutated dozens of times, even in the first few months. But these other variants that we're seeing that are more specific seem to be spreading faster, more infectious, but there's been no evidence that they are deadlier, that they cause more symptoms. And for the current vaccines, the Pfizer and Moderna that we have, it's shown to be effective against nearly all of those. And I haven't heard any evidence of any dangerous variants that are not being covered by these vaccines. Some of the newer vaccines that are being developed, you might hear in the news that haven't been authorized yet, seem to be a little less effective against certain ones. And that's why they're targeting countries with certain variants versus others and making sure that they're getting one versus the other vaccine. But for us in our community and for the United States in general, the vaccines we have are covering all those, and these variants are not causing worse illness or more deaths.
Right. And I think it's important. The virus wants to survive. So the mutations and the variants, these are common, and it's common with every virus. And so it's not something to be overly concerned about. Most of the general population doesn't know that, but it's common with everything. It's a living thing. It wants to survive. And so it changes its to be able to survive. So, and then as Dr. Anderson said, with the vaccines that we have, that's why it's important to try to obtain a vaccine as quick as possible. We don't know with the newer vaccines that are coming out how effective they're going to be against the variant. And it is not the same technology that Pfizer and Moderna have, the mRNA, that newer technology.
Which we believe to be more effective with the variants, is that correct?
Correct.
Yep.
And important as well is the quicker that we get people vaccinated and reduce the transmission of any variant is the less chance it will have to mutate and create newer variants. So the less spread, the more people are vaccinated, the less chance we'll have something that we can't vaccinate against.
So can I put that another way? The sooner we all get vaccinated, the sooner we're going to get rid of the virus or reduce its impact on us as a community, a country, etc.
Very well said.
Yeah. Okay, great. Annette, you have another question?
I do, from Claudia. I had a Moderna vaccine on February 3rd. On the 13th, I had a reaction that is apparently rare and called delayed. Hopefully. Oh, she's calling on the phone? Oh, okay, then we're good. Oh, it's delayed cutaneous hypersensitivity, or COVID arm.
Do you want
COVID arm, I like that.
Yeah, the technical term, COVID arm.
The delayed mucocutaneous or delayed cutaneous reaction has been described with many other medications, or sometimes we call it idiopathic, meaning we don't know why. It's extremely rare on its own, and even more rare with this vaccine, but not life-threatening. It's annoying. It does go away, but it's very treatable. So I think we talked at length about it earlier, but yeah, it's in the, whenever you see the drug commercials and they list the 150 side effects, including what you're trying to protect yourself against, it's in that range of maybe one or two people out of thousands had it. And sometimes it's difficult to correlate. Maybe you just got it anyway and it wasn't really related to the vaccine, but that one is probably likely related, and she should be fine.
Thank you. So I just want to challenge our audience here. Does anyone here have a question? You guys have been outnumbered by all of the people out on Zoom. So we have, thank you, Annette.
I'm Davy. Can you please explain the underlying condition to get a vaccine? Because I know you have to be over 70 right now, and there's others, but what about the underlying condition? Do you have to have proof when you go and get the vaccine that you have an underlying condition?
So right now, it's just based off of age alone. If you were 25 and had diabetes and asthma, that would not qualify you at this time in Washoe County to get a vaccine. So we are strictly age-based.
And was that somewhere on that prioritization lanes as to when
Yes,
we get to?
so it
Wonder if we
goes
have that there.
down, yeah.
Can I do that? No. Alexa, can you bring up the slide for those that are at home with the prioritization lanes, as I'm trying to do the same here without success?
So the way that it goes now is how they had it split up into two different lanes. The top lane is the lane that we're focusing on. Once we achieve a high vaccination rate in people that are 70 and older, and that's 70 with or without underlying health conditions, strictly age-based, then we'll move down to that next one, which should be starting next week with some of the pharmacies. It will be Nevada 65 to 69, again, without underlying health conditions. So once we've achieved a high portion of both of those two first bullet points, then we'll move down into the next one, which is the 18 to 64 with underlying health conditions. They have not released what type of proof you will have to have. It'll be interesting to see what happens if they're going to require you to get that through your medical provider where you have an outstanding relationship with them and you can see the diagnosis codes, or if it's going to be an honor system type. My understanding, I mean, once we hit that point, there's going to be so many access points for vaccination. I think it's going to be, we're not going to run into the same issues that we have.
And from a provider standpoint, our goal is to get it out, not enforcement and regulation of who's getting it. You've heard many stories of people that do not have conditions or age or not truly an essential worker, skipping the line. I think if we focus on those people and keeping them out, it will force a lot of people who do need it and do have those conditions to not get it. So if you have to go and I can't get hold of my doctor and I have to prove I have high blood pressure or something to get it, that's much worse than someone skipping the line. So I think most providers, it depends on what clinic, what area is giving it out, but I think most of us would say, you don't have to prove anything to me. I just want you to have it and I want you to get better.
Thank you. And are they listed what those underlying conditions are that they want to target? Are they in the playbook that you'd shared with me?
Yeah, most diabetes, asthma, any high blood pressure, a lot of almost anything, any kind of health deficiency, I would say.
Okay.
Immunosuppressive diseases, even with children 16 and older or 18 and older, depending on the vaccine. So those are all listed. The CDC website has a good guideline and the Washoe County website has the same guidelines there. You can see those conditions. And we hope at that point that we'll have enough vaccine that you could go anywhere and you should be able to get it. And that won't be so much the limiting factor for you.
Thank you. We have a question. Oh yeah, please unmute Claudia. Thank you, Alexa. So go ahead, Claudia. I think you're unmuted.
Yes, I just wanted to comment about the shellfish allergy. I do have that as well and have experienced anaphylactic response to that. And my doctor pre-medicated me with prednisone the day before my vaccine and the day of, along with Benadryl to try to suppress any reaction I might have. I don't know if other people are experiencing that through their physicians or not.
So from a physician standpoint, I wouldn't fault any physician for considering precautions in that case, because you're talking about a life-threatening illness versus the unknown. So you getting that anaphylactic reaction and possibly dying from that. It isn't currently recommended to do any immunosuppressive therapy like steroids or Tylenol, ibuprofen, or anything like that. But we honestly also don't know. So if it's a safety issue versus getting the vaccine, I would totally follow your provider's advice, and I think you should be fine. And there's a high chance that you'll still have a good immune response and be fully vaccinated from that.
Thank you. Thanks so much, Claudia. So if we don't have any more questions, we're just coming up on 11:30. I just want to thank everybody who's participated today and for all of your patience while we sorted out some technology issues. This is all a great experiment for all of us trying to work out how to make this all happen. So I'm just appreciative of